Hi, my name is Stacy Ann Thompson Gardner, STACYANNTHOMPSONGARDNER. This is my Seneca School ID, and this is my patient script that I'll be handing to my patient. I will now be doing a 360 turn of the room. So, I have a patient here that has a heart rate of 105 beats per minute regular. She also have respirations of 20 breaths per minute, blood pressure 167/100, and temperature 37. The blood pressure and the heart rate, they are abnormal, they are high. So I would give some oxygen and also I would get an order for blood pressure medication, possibly metoprolol, which will reduce the blood pressure and heart rate. I have some questions for you. Do you have any shortness of breath?
I don't think so.
Okay. Also, do you have any chest pain?
I have an ache in my upper chest.
Okay. Do you have any gastrointestinal issues?
I take pills because of my high cholesterol and it's on my blood pressure.
Do you have any palpitations?
No.
Okay, great. Now, how is your usual bowel habits?
No.
Any nausea and vomiting?
I'm nauseous and I did vomit one.
Okay. Any food intolerance?
Spicy foods.
And do you have any irregular heart rate?
No, but it might be fast right now.
Okay. So what I would do next is to do the OPQRST pain assessment. Now I am here, I'm looking at my patient and I can see that my patient is alert and oriented, showing no signs of jugular veins, distension, no edema. Also, I can see that there are no signs of dyspnea, any cyanosis, no signs of visual pulsation. I also can see the breathing, it's even and it's unlabored. Now, I am going to be listening to my patient. Can you please stand for me, please? Okay. Now, I am going to be listening to the 5 areas of the thing. I am listening into the second intercostal space, right sternal border. This is the aortic. Then I will be moving to the second intercostal space, left sternal border, which is the pulmonic. I then will go down to the third intercostal space, left sternal border, which is the Erb's point. I then move to the fourth intercostal space, which is the tricuspid area. And then in the fifth intercostal space, mid-sternal border, that's where I find the mitral valve. Now, with the bell of my stethoscope, I will be listening for any abnormal sounds, S1, S2, which is any murmurs or bruits, to show if the patient has any cardiac abnormality, any heart abnormalities. Now, then again, I will now be listening to the apical area for 1 full minute to see if there's any arrhythmias going on with the patient. Okay, now I will be assessing or palpating the carotid artery. Then I will be doing the brachial artery, feeling the pulse. I will then be checking the radial artery. Now I will be doing the dorsal pedis, checking the pulse. Okay. Now after that, I am going to assess the patient's abdomen. Can you lay down for me, please? I can see that the abdomen is flat and even contour. Also, I will also have checked her capillary refill. The abdomen is flat and contour. The umbilicus it's midline and it's even. I can see no bruising, no scars, no abdominal scars. Okay, and no rashes. Now, the next thing I will be doing, I'm going to auscultate the abdomen. And I started in the right lower quadrant where the appendix is. Then I will be moving into the right upper quadrant where is the liver and the gallbladder. I then will be moving to the left upper quadrant where the stomach and the spleen are. Then I will go to the left lower quadrant where the colon, descending colon is. I will then be percussing those areas to listen for any tympany over solid organs or any dullness over intestines. Okay. Now, I'm going to be palpating those areas in a circular motion again, going clockwise from the right lower quadrant to the right upper quadrant. I'm assessing for any tenderness, rebound tenderness. She does as epigastric tenderness, left upper quadrant and then to the left lower quadrant. Okay, now I'm going to be calling my doctor. Hi doctor, this is Stacy. I'm calling about a 63-year-old female that's presenting with epigastric pain and chest pain along with fatigue and nausea. Now this patient has a history of hypertension, hyperlipidemia and diabetes, and the pain she has started after breakfast that she says radiates to her shoulder, and she had vomited once this morning. Upon assessment, the vitals are heart rate 105, the blood pressure is 167 over 100, the respiration is 20, and the temperature is 37. The cardiac auscultation is normal, the GI assessment, they were normal. It does show some tenderness in the upper gastric, but our vital sounds are good. Now also I would recommend for pain management ECG and a cardiac blood workup for the patient, and also if you can assess the patient. Now what I think is happening, the patient can be experiencing stomach perforation or a myocardial infarction, as well as what I would do as a nurse is to do continuous vital signs monitoring to assess for further deterioration and perform an ECG to rule out myocardial infarction. And two doctors' order that I can expect to get is a stat blood work for troponin and cardiac enzymes, as well as to do X-ray or CT scan to confirm or rule out any stomach perforation.